Hi friends, I've brought a new video for you. This video is going to be on Cellgee tablets. Cellgee tablets contain 100 milligrams of calcium, 45 micrograms of vitamin K2, 400 IU of vitamin D3 and 32 milligrams of magnesium. This combination medication is used to prevent or treat low blood calcium levels in people who do not get enough calcium from their diets. It may be used to treat conditions caused by low calcium levels such as bone loss, weak bones, decreased activity of parathyroid gland and a certain muscle disease. It may also be used in certain patients to make sure they are getting enough calcium, including women who are pregnant, nursing or postmenopausal people taking certain medications such as phenytoin. Calcium plays a vital role in the body. It is necessary for normal functioning of nerves, cells, muscles and bones. If there is not enough calcium in the blood, then the body will take calcium from bones, thereby weakening bones. Vitamin D helps your body absorb calcium and phosphorus. Having the right amounts of vitamin D, calcium and phosphorus is important for building and keeping strong bones. Take this medication by mouth with or without food. If your product contains calcium citrate, then it may be taken with or without food. For best absorption, if your total daily dose is more than 600 milligrams, then divide your dose and space it throughout the day. Do not crush or chew extended release tablets. Doing so can release all the drug at once, increasing the risk of side effects. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. This medication is safe for pregnant and lactating mothers. I hope you like the video. Please like and share our channel. Subscribe to our channel. Thank you.